All right, so this is for dentists, dental practices out there. I'm Eric Chong, and I'm the CEO of UpgradeMyPractice.com. I've worked in dental practices and now work with dental practices that earn at least $3 million a year to help them increase their revenue and improve patient care. We've prepared these practices for exit within 3 to 5 years, so they don't ever have to worry about working as a dentist for money ever again. The reason for this training is for anyone less than $3 million per year is to help you get there so we could potentially work together. All right, so let's get right into it. In this section, we're going to be covering a few topics here. The introduction to this, which is something that might seem alarming at first, but not to worry. This is the best news for dentistry and dental in general. We're going to talk about the one missing thing in 99% of dental practices, and we're going to cover the one question that dentists should be asking. And if you're not already asking this question, I can guarantee you, until you have this question answered, you're going to be holding yourself back, or it's like getting in a fight with both of your arms tied behind your back. And we'll show you some evidence of payment. Everything that I show you here, we do have proof for, and this is a tested, proven system. I'm not just speaking because I like the sound of my voice. I really want to help create an impact and create a change here in the US and beyond. And the solution for that we'll cover is the Health Starts from Mouth system. And you'll see that is the one missing thing. And we'll go over exactly what that is for dentists and dental practices. And then the biggest opportunity that is going right now, it's right underneath your noses, and the window will be open for at least the next 5 to 10 years and probably the next 15 years. So if you haven't already seen, or if you haven't read the writing on the wall, dentistry is dead. I was actually working in a dental office 7 years ago, and I left for this exact reason. If you're still working in one and you're working in a practice that's busy and making plenty of money, well, kudos to you, and you're in a rare bunch, and you need to realize that. And another thing that you should realize is it may not stay that way for long. Now, for the rest of the practices out there, you know, because you experience it every day, that dentistry is dead. And the solution is, it doesn't mean dentists or the dental industry is going away. In fact, it's set up and it's going to be larger over the next 10 to 20 years than it ever has before. I really believe that we're seeing a shift, and we're seeing that hospitals and doctors aren't really who we should go to first, and that going to a dentist 2 times a year, not just for a checkup of our teeth, but the checkup of our oral health, that is the future. So if you're not already on this site, you should visit upgrademypractice.com. You'll be able to find this video and the other videos in this series, and I highly urge any dentist, if you like and appreciate the information that I'm sharing with you, please like and share this with other dentists or other team members or industry members that you think would take benefit from this. So the one simple thing that's missing, and let's first talk about the problem here, because if a practice can go from 1.3 million to 3.3 with just one thing and it's not clinical, then we should all pay attention, or we should all at least know what this one thing is. It's not a small factor. It's actually one of the largest factors in running a dental practice. This is better fit for practices that do a lot of surgery, that do implants, and then perio practices. This isn't as useful for the practices that are doing a lot of ortho or just doing exams and sealants. If you're just doing mechanical stuff, this really isn't for you. But what I would say is that the one thing I see missing in dental practices all across the US is dentists are not being a doctor. So be a doctor and not just a dentist. Get paid for the most valuable part of your pay, and use the proven techniques to get paid. And we'll talk about what that is in this segment. And then, of course, we'll be talking about in the other videos in this series, the software that we can use to make this all simple. So there's about 36,000 new patients every day that are getting activated for this plan that you probably do not know about or have not learned to use yet. And there's one thing that's keeping you from access to this payer, and it's registering for a P10, which is a provider transaction access number. All right, so I just got to read this disclaimer really quick because we live in a very unusual world. The information is provided by upgrademypractice.com, is for informational and educational purposes only. We are not Medicare or any payer. We make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability concerning the information, products, services, or related graphics contained herein. We are not lawyers, doctors, or financial accountants. Please consult legal, medical, and/or financial advice before making any changes to your practice and or patient care. This information should not in any way change the way you diagnose and or bill your procedures. Make your own judgment as a physician and a provider for your work with your patients. All right, now that we got that out of the way, the number one question that I believe dentists should be asking and are not asking is this. I mean, we all know the definition, but it bears repeating right now, and you'll see where I'm going with this if you just hang tight for one moment. So a dentist definition is a person qualified to treat the diseases and conditions that affect the teeth and the gums, especially the repair and extraction of teeth and the insertion of artificial ones. So I think for most dentists, they are really good at the dental codes and getting paid for what the ADA tells them to get paid for. But when it comes to the fundamental definition of what a dentist does, it says right there, it's a person qualified to treat the diseases and conditions. But when I look in the ADA code book, I don't find any codes to bill. So is it possible that 99% of dentists are doing everything right on the clinical side, but it's the office managers or the people running the business are making the biggest critical mistake by not keeping up administratively with the clinical side, right? So said in another way, these dentists are not just any doctor. They're the most advanced clinical doctor in the world. There's nobody else that does surgery or is licensed to do work in saliva, blood, soft tissue, hard tissue, enamel. So dentists are not just a doctor. They are the most highest specialty and highest ladder of any doctor we have in the US healthcare system. They're the only ones that could even take their own x-rays and diagnose them. That doesn't make them less than, because they are specialized and licensed to do more than other doctors can. In fact, that makes them the creme de la creme. They are the pinnacle of healthcare. They just don't get the credit for it, and they're definitely not getting paid for it without this system that I'm going to be talking about here. So the most important question that dentists and dental practices should be asking is how do we get paid from patients or from the payers that promised the patients their health? How do we get paid from these payers for the most important and fundamental part of the work that we're doing, right? And most dental practices, if you're just taking insurance or if you're just doing fee for service, you're not, because you might be, copying the ADA code, and you might even be copying some medical codes. But unless if you're fully utilizing this system that I'm about to talk about, you're really missing the boat. And it could be 30 to 50% of your income or more. Now, I just did a quick search and I took a screenshot here. Dental care in every other country, and including this one, it is a part of medical care. They try to separate it in insurance to make money. And they try to separate it in rules, again, to have power in their organization. But none of that has to do with healthcare. So said in another way, it's good that we specialize to get our license, but it's completely in the disinterest of the patient and the doctor that wants to have a good record to practice that way. We need to practice as in a general way or in a whole way, considering the whole body, not just pretending that the teeth is the only area that we touch and thus the only area that can be affected. Whatever we put into the mouth will affect the rest of the body and vice versa. All right, so I'm gonna get off that. We already know that here. And there's gonna be other training where we go into the details and exactly how the information and unlearning these things is the key to earning what you should at your dental practice and for improving the patient care. All right, so this is just one example. This is one of the doctors that we've helped over the last couple years. And the amazing thing about this check was Medicare, or in all the medical payers that we know, this isn't just about your treatment moving forward, right? So when this doctor got started with us, handed us a stack of cases that they had done over the last 3 months to see that if we can, collect that payment for them. And actually, every payer has different rules, but Medicare allows doctors to go up to about 12 months. So we didn't even send all 12 months. We just sent about the last 90 days or so. And this isn't even the full payment for all of the claims that we sent. This was just the first initial payment that this doctor received. When you do get set up with Medicare, by the way, as a doctor, and I'm not talking about the dental plan, I'm talking about the Medicare medical plan, because as long as you're working on living patients, as a doctor of the mouth, you should get paid for treating the diseases, the conditions, and infections that affect the patients, right? This is literally the biggest hidden reimbursement for dental practices that most dentists are just not receiving because they just don't understand how, or because they're in the OR so much and they don't have the time, but the person that should have their back, the office manager or the billing coordinator, just hasn't quite figured this stuff out yet. And that's why it's so important for the administrative team to be just as diligent and just as educated and knowledgeable in how to keep up with the clinical ability that the dentist has, because dentistry really is one of the most fastest moving parts of healthcare. And I don't mean to digress, but we really need to be on our top A game to support and be able to get our dentist counterparts paid the way that they should. So you'll see an example here. This is a 6-figure check. This is, if I remember, this isn't even, I think this might have been more than 7 or 8 claims, but it definitely wasn't more than 20. So let's just say it's less than 20 claims. I mean, less than a month's of work, right? And you wouldn't usually ever see this kind of check in a whole year. But this is very normal, and it isn't too much. I used to think that this was a lot of money, but surgery should get paid a lot if anytime you do infection removal. This is another doctor that we had helped out here, and the biggest thing that, or their initial response after they received a check was, it's been over 26 years in practice, and they just couldn't believe that they're just learning about this now, and it's better now than never. So if we zoom into looking at the actual visits or the cases themselves, here's an example of what can get paid. So for example, if you're doing some infection removal and you need to do some bone grafting or excision, that will get paid about $466 or $46.68. And don't tell me or don't ask me why it's so different on the mandible and maximal. It just is. But this would be a better example of a more complete treatment and billing. I'm not sure exactly what happened in this one. We probably just broke it up into 2 different claims. But when you have the complete billing here, you can see it adds up to significantly more. And anytime you are doing any implant surgery, if there's any medical need or health-related component to it, you absolutely can and should bill for that. That way, not only can the patient get the treatment that they need for health reasons, and not only you get paid, this way you're not delaying treatment and, causing more reasons for people to be angry at you or your practice, or you as a doctor, right? Not enough people talk about it, but the number one reason for malpractice, and 13.1% of all medical malpractice, is in dental, and it's because of this financial piece. Dentists are only taking dental insurance, or they're patting themselves on the back for taking fee for service. And I'm sorry, if I got even a nickel for every doctor that thought it was a good idea to just do fee for service, unless if you have a waiting list of 6 months and you're a celebrity dentist, fee for service is probably the worst decision that you can make. I mean, I know some dentists out there, and for them, fee for service is great. They're getting more than 70K and for full arch treatment. They command very high fee schedules. It's something more than any medical insurance would ever charge, and sometimes 2 or 3 times more. So in those cases, I get it. But if you're just a fee for service and you're saying no to extra money, extra patients that can pay you and pay you very well like this, I mean, I just don't get it. I don't know why you'd say no to it. Anyway, so you deserve to have checks like this. Your name should be on a check just like this if you are a dentist, especially if you are doing, any kind of infection removal, bone augmentation or reconstruction. This isn't for all dentists out there, of course. Like again, and if you're only doing sealants or you're only doing root canals and you're only doing a couple like amalgam fillings here and there and you're very mechanical, then this isn't for you. Just keep doing what you're doing, and best wishes to you. But for any of the dentists out there that keep improving and keep upping their game and upgrading their practice, and they find that as they continue to improve their skill set, that they just want more options and more tools to help their patients, this is the number one missing thing for dental practices that I can see. So again, if you want to get paid for the doctor portion of the work that you're doing, what you want to do is implement a system where you can get paid not just as a dentist, but as a doctor. So Dr. Smith said about our system that he started full arch implant placement prosthetics in 1988, and he's tried it. He learned it the hard way. So after trying, he learned that it was impossible to do medical billing without a biller and coder, just like you wouldn't do dentistry without a license. Billing and coding is the same way. And when he met this team, he's meeting us, it can make a huge difference who you know. So he recommends the system strongly because it's a streamlined system and something he hasn't seen in over 45 years of dentistry. All right, introducing the Health Starts from Mouth system. The benefits for a dentist or any dental practice out there, it's much more than just increasing revenue and improving patient care. To unlock this hidden reimbursement, you reduce overhead. Most of the medical billing fees that we receive, there's not a lab cost associated to it, and there's not too much more overhead, if at all any. And you get recognized as a doctor. I think this is one of the most important parts. Of course, getting paid like a doctor is very important for the business side, but being recognized as a doctor, as a physician, I really think is the key. And it really is the most important piece of all of this, because when you do get recognized as a doctor, it's very easy to get ahead of your competition. You're not fighting the dental only game anymore. You're a dentist and you're really doing your part to help patients. And when you do so, there's so much demand right now in dentistry done right. When you make this shift, I have no doubt that you'll have more than enough patients and a waiting list, right? And demand really for you and your practice. So all of this is done to put your practice in a better spot, not just financially. You do need money in this litigious society to protect yourself. So it's not just the money increase that helps protect you, but it's actually doing what you promised, not just in your oath, but when you go out to be a dentist. I hope it's not just to fix some teeth. I really hope it's to help the patient be healthier and live a better life. And as a result of the Health Starts from Mouth system, when you can get paid, when you can realize that hidden revenue that you didn't realize before, now you can call the shots. Now you can actually take that 2 weeks off without having to look at your bank account or look at your clock all the time. Now you can take that month off vacation and plan it and enjoy it and know that you'll be okay when you get back. When Medicare or any medical insurances pay in a patient-doctor relationship, from my experience, I find it's a little different because You get paid as a doctor and not just a dentist. And this is the biggest shift that's coming to dentistry, because as we know more and more, there's stories of like Demonte Driver. I think he was like 21 and he died because he didn't get an extraction, right? So it's not just the obvious and clear medical need when it's outside of the teeth. Sometimes even a simple infected tooth can cause us death. So it is important for us to be seen as a doctor, so that way we can get paid but also recognized, and the patients will come to us for help instead of ending up at the ER or at a hospital when it's too late or when they can't help, right? So you should get paid in full. Medicare does pay all day long. They have a very consistent track record. For us, it's been about 99.8% of all the claims that we send. They do get paid, and they get paid very consistently for us in our system. And we just want to share that with you and let you know that it's possible for you as a dentist as well. So you can see this is the 1099 that we have for just one of our payers, and it was almost 900,000. And this is something that all the dentists out there should be getting. Again, this isn't just about the money. Every single dollar and penny translates to improved patient care. And this is kind of money that 99% of dentists are just leaving, on the table. And I don't want to see you leaving that on the table. All right, so what's this really mean? We'll get into the other videos and break down how to actually do this, but I just kind of want to give you the benefit or the end result, so that way you can get a sense of what this even is. So let's just say that you're doing like an implant crown treatment. Everybody knows if you have dental only, you're not going to be making that much. And although some providers think that with cash only, you can make more, but actually you can make less, or you can make more. It really depends on how good you are at marketing or the business and presentation aspects, and of course how much they trust you. So what I'm trying to say is, it doesn't really have much to do with your clinical ability. It's the perceived clinical ability and your ability to sell that. And then with medical billing, that's where you actually start to see an increase now, because now you're fully getting paid for the most important part and the fundamental part of your work. This is the biggest missing piece for all dentists, because they're so focused anytime they hear that word dental, they forget about the medical component of it. And then there is dental with medical billing, and the biggest difference between medical billing only, which would be the reverse problem, because as a dentist, if you're doing medical billing, why not also do the dental billing? But when you do both, is you're just able to give more options to the patient and make it easier to accept treatment, because it's less out of their pocket, right? And here's just another view at it with some numbers, just to give you a better idea. But yes, the biggest difference is when you use medical billing and then you use the dental billing, then their patient portion is low and affordable. And if not, sometimes it's eliminated. So that's what we're talking about. If at any practice, when you start, without having a superstar sales team, and even if you do, you'll have people that shop around. So it's about moving from the left side of the screen to the right side. In the left, before the Health Starts from Mouth system, you probably have a lot more people that shop, or a lot more people that just simply say no and deny the treatment because they can't afford it. But when you have the Health Starts from Mouth system, we're going to see a lot less people shop, and you'll see a lot less people saying no, and a lot more people saying yes. At least that's how it's gone for our experience. So here's another doctor that got started with us. He wanted to market his practice because he was just opening his doors again, and he said he liked the medical billing but wanted to get more patients, and he tried just one ad of ours. We have some approved language on there and things that we know works to get patients, and he got 11 calls on his first day, and 9 of them turned into appointments. And the best part is all of them but one were Medicare, so he got paid for them too. So you have 2 options, and this is something that, it's completely up to you. It's your choice. I talk to office managers, mostly office managers. I do talk to dentists, but I try to call out and I try to reach new practices every day. But you'd be surprised. Most office managers say no to all of this money on the table, and I don't think their dentist would be too happy if they realize what they said no to, even with that word Medicare. So I'm giving you that same opportunity and choice now. You can say no to it all. You can say no to the money on the table that's there, and it's probably invisible. You don't have access to it right now. Or you could choose to get the money that you deserve. You could choose to get paid and claim the money that you've worked hard for. The reason why this is so important, because especially in the 65 and older category, 9 out of 10 patients we find they are turning down treatment and they can qualify. So 9 out of 10 patients, they have some medical need or some health related reason, and they do have Medicare at 65 and older. And it's not just 65 and older, even down to the 20s, where I've seen a 20-year-old that has Medicare, because any chronic condition or illness, you can apply and get accepted. So don't turn that away. There's 36,000 new patients every day that are being activated for Medicare and these benefits that we're talking about. This is literally the largest demand and need in dental, but no one's going after it, and not the right way. They're not providing all the options. They have all the clinical ability, but their administrative is lacking so much. They really need to know this information. And for baby boomers, this is really just the beginning, because this 36,000 person a day push will be going on for the next 10 years, about 8 to 10 years, and it's predicted to have a 10 to 12% increase per year. So that's it for this video. The reminder or the message is to just get your doctor's pay, because dental is medical. If you're not already on this page, be sure to visit upgrademypractice.com/learn. You can see this video and any of the other videos in this series. And if you did appreciate, or you've enjoyed, or you've learned anything from this, please reach out and let me know, or you can like and share this information with anybody else that you think would benefit from this. So in the rest of this series, we're going to be going over exactly why you should be doing this Health Starts from Mouth system, what it is, when you should do it, not just like when you should start, but when you should do it in your practice with new patients, and the how to do it. And of course, we'll be sharing some case studies, exactly the difference that it's made for other dental practices and the difference it can make for you. So again, if you're not already on this site, you can visit us at upgrademypractice.com/learn. And I'm signing off, but I just want to leave you with my intention of sharing these videos is so you have your absolute best year in dentistry over the next 12 months. And you have better years, year after year after that to come. Take care, and we'll see you in the series.